Thank you for joining us on our show today. On February 4th, we observed World Cancer Day, a global initiative uniting people worldwide in the fight against cancer. This day serves as a powerful reminder of the impact cancer has on individuals, families, and communities across the globe, and the urgent need to take action. Today, we are glad to have in our studios with us Dr. Saro Jacob and Dr. Vinu from Bangalore Baptist Hospital. Dr. Saro Jacob is a consultant, the head of the Department Oncology, Radiation and Oncology. Dr. Saro has extensive experience and has been with Baptist Hospital since 2008 as a consultant radiology oncologist. Her special areas of interest are in head and neck tumors and breast cancer. Before joining Baptist Hospital, Dr. Saro was trained at CMC Vellore for her fellowship training in emergency medicine and for her postgraduate studies in radiation oncology. Dr. Saro Jacob is actively involved in raising awareness on cancer and in training undergraduates and postgraduate students. We also have in our studio today Dr. Vinu Sarathy. He's also a consultant medical oncologist. Dr. Vinu Sarathy joined Baptist Hospital in the year 2020. He has completed his MD General Medicine and is now serving in the oncology department. Thank you, Dr. Saro and Dr. Vinu, for joining us on our show today.
Thank you. Thank you so much.
We'll begin our show. The first question, I think we really need to understand this disease on cancer. The first question to you is, what is cancer and how can a layperson understand the word cancer? Dr. Saro, if you can share your insights on this.
So, cancer is basically a disease where a person's own cell undergoes certain changes or mutation, and this cell becomes abnormal. So, this abnormal cell then divides uncontrollably and grows into a tumor. It can also invade the surrounding neighboring structures like a bone or blood vessel or a nerve and cause harm there. So it can invade into a nerve and cause neurological deficits. It can erode into a bone, causing break in the bone or bone pain. It can erode into a blood vessel and cause bleeding from that area. Not only that, this abnormal cell also has the potential to spread to other areas, that is, other areas in the body or to other organs, and go there and cause harm in those areas also. For example, if the tumor is arising from the breast, it has a potential to spread to other areas like lung, liver, brain, and cause harm there too. So cancer can also cause, we know that it can actually cause death in the patient. So that is one of the things that is quite dreadful about this disease. And basically, when we talk about cancer, it where it starts from is the primary of the tumors. For example, the abnormal cell originates from the breast, then it is a primary breast cancer, and there it spreads to it becomes the metastatic or the secondary site for this cancer. I hope that answers your question.
Yes, ma'am, it does answer the question. So, a follow up question to this is that I think you have already mentioned a few. What are the most common types of cancer you see in your practice? And are there any noticeable trends or changes in prevalent today?
Of cancer, yes. So the most common cancers that we see and that is seen worldwide among adults are basically cancers of the lung, breast, cervix, and colorectal. Now, if you look at our Indian population, the most common cancer among women is breast and cervical cancer, and among men it is lung and prostate cancer. And in our Indian population, the other type of cancer that we see is basically the head and neck cancers because of our Indian population having, using tobacco as the chewing for chewing tobacco and also for smoker in smokers. So we see a higher number of patients in our Indian population with cancers which are involving the mouth, that is the tongue, the oral cavity, and even the pharynx. Among children, the most common cancer that we see are basically the cancers which are involving blood, that is leukemias and lymphomas, and also we see children, large number of children coming down with brain tumors and also muscle tumors. These are the most common tumors that we see in children. What is the next question? Sorry, Hannah.
Uh, yeah, coming to the next question, are the risk factors? I think Dr. Vinu can answer this question. What are the primary?
Sorry, Hannah, to interrupt. I think one of the questions you asked is what is the trend that we see, the change in stress and the prevalence? Yeah. So that is a very important question because, I want the viewers to understand a few things, regarding cancer that we are seeing a higher incidence about. So one of the most important thing is what we see is patients, they are noticing that there is a higher increase in breast cancer. So, and this is worldwide. So, this is something which I want the viewers to know and understand because we can make a difference in trying to, and not bring down the incidence, but probably we can make a difference in raising awareness about breast cancer so that patients or our dear ones will be detected in an early stage of cancer where there is a high chance or potential at cure. So that is something that I want the viewers to understand. There is an increasing incidence of breast cancer, and that is probably because of the change in the last few decades in their lifestyle changes. Because more people are getting their first child at a much earlier age. Uh, Women are opting to have lesser children. Women are living more sedentary lives. There is higher incidence of obesity in women in the present era. People have less, like I said, less physical activities. So these are all some of the reasons that probably there is a higher incidence of breast cancer. Now, in India, there are certain figures of breast cancer that we need to really understand and digest, and each of us should do our little bit to raise awareness about breast cancer. Now, in India, if you look at it, breast cancer is the most common cancer among women in India. It has even exceeded cervical cancer, which was the most common cancer, about 2 decades earlier. But now, breast cancer is the most common cancer among women. In India, 50% of patients with breast cancer are diagnosed less than the age of 50. That means these are women who are young and a woman in her 30s, 40s, and in her 50s. This is a stage in her life where she has a lot of work to fulfill, both in raising up a family, looking after her family, her children. She has to contribute to her work that or career. So we find that we are having a large number, that is about 50% of our women or more, are diagnosed with breast cancer are below the age of 50 years of age. The other thing is that in India, 30% of all newly diagnosed cancers are breast cancer. That means if you have an oncology OPD and you have 10 new women patients diagnosed with cancer, out of these 10, at least three of them will be diagnosed with breast cancer. So that is some important figures for us to understand. The other thing that we need to understand is that in India, more than 70% of these patients diagnosed with breast cancer come in a far advanced stage of cancer. That is in stage 3 and stage 4, where the chance at cure are less. And also, we need to understand that in India, as of now, the figures are that for every two women, for every woman that is or two women that is diagnosed with breast cancer, one of them will die of the disease. So these are some of the real hard facts that we need to understand about breast cancer, and uh, and how does this knowledge help all of us as layperson also, not just the medical fraternity, but also the layperson, is that we need to do, all of us need to do as a community, need to raise awareness about breast cancer, so that our loved ones, if they have breast cancer, if they do a screening for breast cancer, they will be able to pick up this disease at a much earlier stage, so that the chance at cure can be very high. So this is something that we really need to know. Now, the other cancers which are on the increase are lung cancers, and we are seeing this trend mainly in increase in non-smokers. And this may be because of because of air pollution, because of heavy traffic and industrial smoke that are so rampant there now. The other thing is we are seeing also that there is an increase in colorectal cancers, again because of the lifestyle changes in the present last 2 decades of having more diet which is less in fiber, having more of processed food, having a sedentary life, increase in obesity. These are all some of the lifestyle changes that people have, opted for, and that's why there seems to be an increase in even tumors like colorectal tumors. There has also been an incidence in terms of prostate cancer, and that may be because of better screening. But the good thing is that in prostate cancer, because these are detected at a very usually at a very early stage, there is a high chance at cure, and there is less chances at death also due to prostate cancer. So these are some of the changing trends that we have been seeing about the prevalence of cats. Thank you. Thanks, Hannah, for the question.
Thank you, Dr. Saru, for just bringing to light and uh, showing us that there is an increase and we need to really be aware of these cancers. My next question is to Dr. Vinu about the risk factors for cancer and how individuals can reduce their risk. So, what are the primary risk factors and how individuals can reduce their risk?
Yeah. Uh, so, obviously, cancer is a very scary one, and as soon as you mention cancer, it brings a stigma and a lot of fear associated with it. But we have to understand that most of the risk factors for cancer is within our hands or our control. In fact, in India, we have seen that out of 10 cancers, almost 5 of them are due to tobacco-related uh, carcinogens or tobacco-related cancers. And even they say up to 7 out of 10 cancers are actually due to what we say modifiable risk factors. So, cancers risk is usually due to two things called risk factors, which are in hand, which is modifiable, and unmodifiable, which are due to genetic factor and aging in general. So, these two are not in our hand, and they only constitute very low, only around 15 to 20% of cancers. The majority of cancers are due to risk factors. Like in India, still the most common or the topmost reason for cancer is tobacco, either in smoked form or smokeless form, like chewable form or snuff and areca nut chewing. So all this is the major reason in India for tobacco is known to cause more than 12 different types of cancer. So just by omitting tobacco and its product, I think we can reduce the cancer burden by up to 50%. The remaining risk factors, which are like ma'am said already, is a poor diet, a lack of physical exercise, stress, living in areas with more pollution, uh, more exposure to particulate dust, industrial pollution, and all this. So these are all the other modifiable factors which add on. So just by adopting a better lifestyle, completely avoiding tobacco, alcohol, ensuring her stress-free life, getting adequate physical activity, having a balanced diet can actually reduce the cancer by up to 70% if done the right way. Thank you.
Thank you. Thank you, Dr. Vinu. My next question is uh, Dr. Saro, can you explain the difference between a benign and a malignant tumor?
Yes. So a benign tumor is basically a non-cancerous or a non-malignant growth, and uh, you know It can occur in various places or various regions in the body, like a fibroadenoma in the breast, or a fibroid which is there in the uterus, or a colon polyp that is not cancerous, or what we call as a fat tumor, what is called as a lipoma, which occurs under the skin. Now, these tumors are generally don't cause much disturbance in the patient, or does it cause much problems in the patient. They generally tend to grow relatively slower than a cancerous growth. They generally, like I said, don't cause any disturbance in the place they are, unlike a cancerous growth or a malignant growth, which cause destruction to the surrounding areas where it grows. A benign tumor doesn't cause much problems. It can cause maybe some, compression on the nearby structures, but it doesn't cause any destruction of the nearby structures. It doesn't directly invade them. A benign tumor also does not have a potential to go and spread to other areas and cause secondaries, or doesn't metastasis, it doesn't spread to other areas. That is one. That is one of the major difference between a benign and a malignant tumor. The other important uh, difference is that in a benign tumor, usually the treatment, if it is causing any, functional or any cosmetic problem there, then you can actually just remove the tumor by surgery alone, and it does not really require other modalities of treatment like radiation therapy or chemotherapy. And usually, if the tumor, a benign tumor is removed, it usually doesn't come back, unlike a malignant cancer, which has a high potential for it to come back. So, these are the main differences between a benign and a malignant tumor. Thank you, ma'am.
Dr. Vinu, what are the warning signs of cancer? And that, if you can share it to our viewers, and what should we keep in mind and not ignore? If you can just throw some light on it.
Yeah. So, as a general rule, we say the cancers usually when they present, we have no cancer which obviously presents with a lump which is superficial, like a skin cancer or breast cancer, where it is very clearly visible and we can detect it very early. So skin and breast cancer are some things which can be picked up early as they present with an obvious swelling. But the other cancers which are more deep seated, like lung or colon or stomach cancer, these are deep seated, so he generally do not notice them till it's too late or till it spreads significantly. So what we say is, as a rule, any nagging symptoms which you would attribute as to being just a allergic pop or just gastritis, if it does not go away for beyond 2 weeks, you say please go get it checked, like not just with blood test but do a scan, or please consult your nearest physician or a oncologist to further evaluate the symptom. Like most of the time, a lung cancer is they present with a cough which has not gone away for 3 to 4 months. Similarly, somebody had been treated for gastritis, for indigestion, heartburn for more than 3 4 months before they actually realize it's due to stomach cancer. Similarly, if you are having constipation or diarrhea which is new onset, or you're having blood in stools and it has not gone away for 3 4 months and is being treated with over the counter drugs or self remedies, he said do not all neglect or ignore a usual sign which does not go away for beyond 2 weeks. So generally, any nagging cough, any blister or any you moan on the skin which has suddenly appeared on changing its size, or any constipation or new onset diarrhea, abdomen pain, any lump or swelling which is not going away, persisting for beyond 2 weeks. So anything you notice unusually in your body which you have tried local remedies but it's not going away, it's better to get it checked so that we root out a bigger cause like cancer. And even if it is detected early, the cure rates are very high. And of course, for people who have more than two relatives in their family, first or second degree, who have been detected with cancer early in life, that there is a strong possibility that it could be a genetic cancer. So they should go earlier for genetic counseling and get the appropriate tests, so we can risk stratify what is their chance of cancer, and it could be caught early or even prevented. Right. So, like I said, as a thumb rule, any nagging symptoms which is not going away beyond like 10 days to 2 weeks, please get it checked.
Right. Thank you, doctor. How has cancer treatment advanced in the recent years?
Yeah, ma'am. So basically, what was the way cancer treatment is evolved is see, cancer, what they use is chemotherapy drugs. The chemotherapy drugs is a type of toxin or a poison. Most of the chemotherapy drugs which were discovered were all serendipitously say or accidentally discovered. So this was the way cancer treatment was there initially during the 70s, 80s, possibly even till the mid 1990s. That is when our thinking about cancer changed, and we have now done so much research into cancer. We have mapped out the entire genome of almost more than 35 cancers. So we exactly know now which cancer is growing due to what mutation, what causes the cancer to grow, and what causes the cancer treatments to stop working in them. So all this we have understood. Basically, we have a better understanding of the biology of cancer. So when we know the biology of cancer, when we know what mutation is causing the cancer to grow, we can specifically we can design treatments against these cancers. So we have moved to an era what we say is the targeted therapy and immunotherapy, and we have even more cutting edge like CAR T cells, and newer we are trying cancer vaccines. So it is moving in a far more targeted and precision oncology, what we say. So in that way, we already have around 12 to 15 medicines which do not kill like chemotherapy, which don't act like a poison where there are side effects, but they act specifically on the cancer cell, which is causing on the mutation, which is making the cancer grow. So it is very specific to cancer cell and spares the normal body tissue. Similarly, here see immunotherapy. The first line of defense for any cancer is our own immune system, but somehow the cancer is blocking it. So we have got new drugs to release the block and help the immune system clear the cancer themselves. So these have made a big difference here. See, the survival rates have gone up 30-40% when used correctly for appropriately for the patient. Is newer therapies with lesser side effects and far more efficacies. And of course, in the future, we will seeing more precision where every patient is taken individually and they are specifically treated as per the cancer type and as per its molecular pattern.
Hannah, please.
Yeah, yes, Dr. Sara.
Also, to add to what Dr. Vinu has said, there's been a lot of advancement in the field of surgery and also that's cancer surgeries and also in the field of radiation therapy, which is also used for the treatment of cancer. So just to tell you that also for radiation therapy, earlier we used to use this conventional treatment for radiation, where there was a lot of radiation exposure to the unnecessary areas that we wanted to target with radiation. But now we have better machines where we are able, that is radiation machines, where we are able to deliver precise radiation, that is a higher dose to the tumor and lesser dose to the surrounding structures. So the cure rates have increased and the toxicity from the treatment, that is both, as Dr. Vinu said, from systemic therapy and from the other modalities, that is radiation therapy and surgery, the side effects have come down a lot. So we are seeing better cure rates and lesser side effects from the treatment. Thank you.
Thank you. Thank you for sharing that. Dr. Saro, the next question is to you. What is the importance of early detection and screening in improving cancer outcomes? What screenings are recommended for different age groups and risk factors?
So, Hannah, let me just tell you what is screening first, because that is important for the viewers. When we use the word screening, it means you are looking in a group of people, that is a group of people or in a population that don't have any symptoms. That means they're a healthy group of people. They don't have any symptoms of cancer. You are doing certain tests or examination to see whether these people have early cancers. So some of the tumors, in fact, the four tumors or four cancers where we do screening, one is the breast cancer, the next is the cervical cancer, the third is colorectal cancer, and the fourth is prostate cancer. So you're basically doing some simple tests that are easy available, that have a high sensitivity, that have a high specificity to see whether uh, these people, that is a normal or healthy group of people, have cancers in them. So let me just elaborate because the screening tests are very important in detecting cancer at an early stage. We know that when cancer is detected at an early stage, there is a high chance at cure, and the treatment for the early cancers, you do not have to use all the modalities. So in early cancers, you may just have to do only surgery, or you may just have to do radiation. You may not require to do all the three modalities of cancer, and there is a high chance at cure. So let me just elaborate because I want the viewers to understand why screening is important and what are the screening tests. Now, if you look at breast, it is when we talk about screening in breast, it is basically all patients and now sorry all women above the age of 25, they have to do a monthly self breast examination. It is a very easy thing to do. There is a lot of literature which is there if the on the net or on brochures. You can get leaflets or brochures that will tell you how a woman should examine her own breast. So, and any abnormality that they see, like a lump or any discharge from the breast, they can come and seek the attention or a consultation with a doctor. All women above the age of 40 years can go and meet a doctor for a clinical examination and have an annual mammogram. Now, when we talk about mammogram, it is just an outpatient test. The patient need not get admitted. It is a very simple test, which is an X ray imaging of the breast, which is done on a mammographic unit. And the breast is viewed from top to bottom and from the side in this mammographic unit. And very small tumors can be picked up using a mammography that even can be potentially missed by the patient or the examining or the examination by a doctor. So tumors which are even less than a centimeter, which is difficult to feed by the doctor or the patient, can be picked up by a mammogram. So it is very important because when you detect these tumors at a very early stage, just a simple surgery may be sufficient to get rid of the cancer at this stage. The other important test that we do is yes, let me just finish on mammography. Like I said, women above the age of 40 years should get an annual mammogram, and those patients who have a higher risk of developing breast cancer, that is, with a strong family history of breast cancer, and their relatives have had cancer at age more earlier than 40s, then these patients should actually go for screening for breast cancer at a more earlier age. So they may have to start screening by the time they're 30 years of age itself. The other cancer is cervical cancer, and the screening techniques or the screening test that is used for cervical cancer is again a simple OPD test, which is a pap smear. A pap smear can be done by even a trained nurse. It is very simple procedure where a small scraping using a wooden spatula, scraping is done from the cervix, and the cells are smeared on a glass slide, and they are studied under microscope for looking for any abnormal cells or any precancerous. That is, even before the cancer arises, this test will see if there is even precancerous cells which are present in the cervix. And all who should get a pap smear or who should be screened for cervical cancer, all women who are sexually active should be screened for cervical cancer till the age of 65 years. The third cancer that is mentioned is colorectal cancer. Again, for the test for colorectal cancer screening are you test the stool for occult blood and a colonoscopy. That is also a OPD procedure, and all that is men and women above the age of 50 years should get a colonoscopy done for screening for colorectal cancers. Coming to prostate cancer, again, the screening test is very simple. It is just a blood test called serum prostate specific antigen or a PSA test, and it is now available in almost all hospitals. And all men above the age of 50 years should get a screening test done for prostate cancer. So these are the things that are presently available, the screening tests that are presently available. Now, just to add, I think one of the your question was, is there a high risk group that we need to do any separate screening? I just want to mention that for lung cancer, which is now rapidly on the increase, for patients who are chronic smokers, there is a role of doing a low dose CT scan for screening for lung cancer in these patients, but actually it has not yet come out in large guideline. But that is something that we can keep in. Nice.
Thank you, Dr. Saro, for explaining and elaborating on the different screenings and the importance of early detection. Dr. Vinu, can you just address some of the misconceptions that people have about cancer? Would you like to address that?
Yeah. So, the first thing we encounter is there are a lot of myths and misconceptions and preconceived thoughts and notions already from the patient. One of the first things is when the cancer is detected early, they think that there is a general thought and there's a general belief that it can be treated with some local remedies and unproven ways which the tumor or the lump will go away. And usually they try that for 3 4 months and then they end up in advanced stage and we see them all this initially because there's a stigma associated with the word cancer, and they are in denial and they would want to try some unproven methods and then try for the actual uh, proven or the evidence based methods. Secondly, there is also a lot of misconception that the treatment for cancer like chemotherapy, surgery, radiotherapy is actually more dangerous than the cancer itself. That is the biggest myth because no treatment will be established or come into practice unless it has a proven safety profile. So all of our cancer treatment, either chemo, radiation, or surgery, they are also a parameter of safety or adverse effects where the safety is established, especially early on in phase one itself, and then only the drug or the therapy is approved. So no treatment is actually more dangerous than the cancer itself. And these days, we have very good supportive therapy, medication. We have very good treatments for nausea and vomiting, very good other supportive treatments with which we can very much 90% of the side effects are very manageable. Thirdly, many people think cancer is still a contagious disease, and so the caretaker asks us, "Do we will we get also cancer caring for the person, or can we test the patient? Can we use the same utensil or the same washroom?" So I think it is not a contagious disease. So the caretakers need not worry about it. So this is one of the misconceptions we have commonly see. And of course, no symptom is ignored is going to go away on its own. It's better to get it evaluated and treated. So we feel these are the general misconceptions. And one more thing is early on, if the cancer is detected, the cure rates are definitely way higher than when detected later on. So it is important that the symptoms are not ignored. Important that we understand that the cancer can be treated very effectively early on. It's not a contagious tumor, and the cancer treatments are not that bad that it is worse than the cancer itself. So this is very important for them to understand. And one more thing is all the treatment is evidence based, or we have a set of guidelines which we follow. So like Madam I said, few cancers require only surgery. Few require surgery and chemotherapy. Few require surgery, chemo, and radiation. So it's not a one rule or it's not a one set of treatment for all patients. So we have patients telling that patient got only surgery, why are you also giving the chemo? Because it depends on the type of cancer, the stage at what we detected in, and even sometimes we say the aggressiveness of the cancer. All this is taken into consideration. One more thing to remember is it's not a one treatment which fits all patients. Some patients require more, some less. So again, to clear the misconception, just because somebody had all three chemo, radiation, and surgery, the other person may not need all three. So it is tailor made as per the stage and as per what we practice as per our guidelines and evidence. So these are the common misconceptions what we know. And most of the side effects like hair loss or skin changes, indigestion, most of them are 90% reversible. So again, they are not permanent side effects with which the patient has to live with. Thank
Dr. Vinu, to continue on, we know that lifestyle is very important. So, can you just throw some light on how does lifestyle, that is maybe diet or stress and other things, impact the diagnosis of cancer or the prognosis? And also, if you can also share about what role does genetics play in cancer development?
Yeah, firstly, regarding genetics, around only 5 to maximum 10% of cancer are genetic basis, which means the person is born with the genetic mutation, and usually it takes another 20 30 years for which the genetic mutation to actually cause a cancer. So that type of cancers are only 5 to 10%. What we say as germline cancers or hereditary genetic cancers. So this is strongly suspected if somebody has a cancer at a very young age, or somebody has a strong family history where the mother, father, or siblings, or more than two second degree relatives like aunt, uncles, or cousins have been detected cancer. Then we tell them to go for a genetic counseling and get the test done, so we can identify it earlier or screen him or her, and potentially also prevent the cancer in the individual. Most of the cancer, 90% of them, are what we say as sporadic or not due to genetic factors, which means the individual is born healthy, but due to various factors like the environment, diet, stress, inadequate exercise, all this eventually, and as per other risk factors like smoking, alcohol, eventually these are the factors which causes a mutation and causes the cancer. So 90% of the cancers, what we say is not genetic. We have but unfortunately, in that 90% of cancers, clearly to say this was what caused cancers, we can hardly do it in hardly half of them. Like like we have a direct causal association of smoking and cancer. The diet, exercise, stress-free lifestyle, these things we don't have like direct evidence, one is to one evidence saying this is definitely causing cancer. But we have seen it times that as the lifestyle has changed into a more sedentary lifestyle, a diet has changed where the fresh fruits, vegetables, fiber content has gone down. People are consuming more preserved food, more of saturated fat, less of fresh fruits, vegetables, more alcohol being consumed, more of sedentary lifestyle, more night shift workers, and more more sedentary lifestyle. Basically, more of stress. We are seeing the cancer incidents are increasing, and some of the cancers were just directly associated with lifestyle or diet based are colon cancers, liver cancers, gallbladder cancers, and even some of the breast cancers. So definitely they play a role. With active exercise, like what we say, around 150 minutes of aerobic exercise in a week, daily 2 to 3 servings of fresh fruits and vegetables, limiting red meat intake, avoiding alcohol and tobacco, getting good 7 to 8 hours of sleep, trying to minimize stress, living a good, what we say, good social life with surrounding with good friends and family. I think these, they say, contribute to almost 30% of reduction in cancer risk factors. So definitely it plays a major role. This is what we can do maximum as individuals to prevent and avoid cancer. And the 10% genetic, where they have to be aware and go to a genetic counselor. Thank you.
When we hear the word cancer or a patient is told that he or she has cancer, normally they have fear. I've heard some of them break down, cry. It really bears upon their emotions and their psychological aspects. So, Dr. Saro, what are some of the emotional and psychological challenges faced by cancer patients, and how can they be addressed?
Yeah, Hannah, this is a very relevant question. And as you rightfully said, cancer diagnosis is a crisis, and it is a life changing, for these patients. And the diagnosis of cancer, it actually brings a lot of intense mental stress onto the patient and, of course, to the family. So they go through a period of anger, they go through a period of fear. There's a period of denial in which they think, how can this happen to me? It's really not happening to me. And of course, they also have to accept later, the stage of acceptance also comes in. So it is definitely a period of severe mental stress for patients who are coming into terms with their disease, and also the acceptance of going forward into treatment. Going through surgery, going through radiation therapy, or going through chemotherapy is not easy for the patient, because they will experience, apart from side effects, they will also have other issues that, there will be some disfigurement, or there could be some cosmetically, there could be some changes in their body. So it is really a period of both emotional, psychological, spiritual, and physically, it is very challenging. We see in a good number of patients, I would say about one fourth of patients with undergoing cancer treatment are actually having medical depression and anxiety. And we, as doctors, when patients come to us, that is something that we look out for. And if we find that they have symptoms of depression and anxiety, we generally send them across to a counselor. That is what we call as a clinical psychologist, to counsel them regarding the depression and anxiety that they have, and or the questions that they have. And we also send them to a psychiatrist, because many of these patients will also require treatment, that is anti psychiatric drugs also is something that they will be requiring during the treatment for cancer. So that is one thing that we do. We also encourage them to talk out, ask questions, to know more about their disease and the treatment. We also encourage them to talk to other patients who are undergoing similar treatment, so that they can get support. They can know how those other patients are coping with this treatment. The other thing that we also offer them is, because many of them tend to lose hair during treatment, or many of them may have removal of the breast. So we encourage them to use things like breast prosthesis. We ask them to use wigs during the treatment, so that cosmetically, they will not be very much affected while they are on treatment for cancer. So these are the few things that we encourage our patients to do, and how to address these problems.
So, how important is the support system, the families of the patient, and what advice would you give family and friends?
Yeah, Hannah, we do know that, and I'm sure that all our viewers know that, not just for cancer, but for any disease that a person goes through, a family support is very important, especially in our Indian culture. We rely a lot on our families for making all the decisions in our lives. And similarly, when a patient is going through cancer, the patient requires and tends to rely very much on the family for support, in terms of physical support, in terms of emotional support, and of course, financial support. So it is something that we all rely on now. We need to understand also that while the patient is being supported, the other group of people that really requires support is the caregivers. The caregivers are the near family, or friends who are supporting the patient while they are on treatment. And this group of caregivers are actually not very much addressed, because the focus is on the patient and the patient's treatment. That the people who are supporting the patient, that is the caregivers, are hardly addressed, or we hardly focus on them. But they are also going through a lot of stress, emotionally and physically, during this time. They are also dealing with the diagnosis of cancer in their loved ones. They are dealing with the fear of losing their loved ones to cancer. They are also dealing with financially how to support their loved one with cancer. Many of these caregivers may be balancing a lot of things. They have to handle their own careers while taking care of their loved ones with cancer. So there is a lot of emotional stress on the caregivers also. And how we, as doctors, what we tell, the caregivers, that is the close family members who are taking care, or friends who are taking care of the patient, is that take care of yourself. You are important. Take care of yourself. You need to take rest, physical and emotional rest. You need to take a break, and ask somebody else to take care of the patient during that short break that you take. You need to eat well, exercise well, sleep well, and you need to also probably reach out to other uh, caregivers who are taking care of their loved ones, and form a support group with them, so that they will be able to give you tips on how you can go through this period. You can talk out to them, you can vent out your fears, your frustrations which may be there, to this like-minded caregivers. So these are some of the things that we encourage the caregivers, because they can also break down, and because they are also going through a lot of emotional stress during this period. Like you
Thank you,
Hannah.
Doctor. Thank you. Dr. Vinu, if you can just throw some light on what are the biggest challenges that in cancer care today.
Yeah. Coming to our country, the biggest challenges, what we would like to say is first thing is the awareness, ma'am. The awareness is definitely a lot lesser than the Western population. The screening, the number of people coming into screening and getting detected early are far lesser. So we do see cancer at a more advanced stage than the West. So I think the more the people are aware about the signs and symptoms of cancer, the more they are aware about the screening modalities available for the four different types of cancers madam has spoken about. So we will be able to screen them early, detect them early, and of course, definitely we will be able to increase the cure rates also. Secondly, is of course to through these talks and through awareness programs, we can definitely dispel the myths regarding cancer. So patients choose a more established basis of treatment rather than trying experimental unproven ways, so that they can maximize their chances at cure rates. So this is also a important way. And of course, many have their own myths and misconceptions that the treatments for cancer are deadly. So we have very modern technologies in terms of radiotherapy and newer ways of surgical treatment, better chemotherapy and targeted therapies where side effects are very minimal. And so helping them understand the treatment is not as bad will also help the patients. Then of course, in our country always there is the financial aspect is always there, which is a big barrier towards cancer treatment. But interestingly, our country, we do have very important schemes like Ayushman Bharat and health minister's cancer relief fund, where for all the people below the poverty line, up to 5 lakhs of treatment is given free of cost in more than 100 regional cancer centers across the country. So even our country, we are doing a great deal to even help the people who are not so financially well off, so that they are not at a disadvantage or at acquiring latest treatment. So these are all we have to educate the patients that we have a latest treatment available, and it is at reach for almost everybody with the proper schemes. And I think with proper awareness programs, we will really help in educating the people to come and get screened, detect it early, and make sure they go to the right treatment and help them at maximizing their cure rates.
Thank you, Dr. Vinu. My final question to Dr. Saro. Dr. Saro, what is the message of hope you would like to give to the patients who are right now battling cancer?
Yeah, Hannah. So, what we tell our patients who are undergoing the treatment for cancer is that we tell them that this disease does not define them. We tell them to focus on being strong, having hope, and we tell them that if they need to concentrate on completing their treatment in time, because completing their treatment in time, whether it is radiation or chemotherapy or the time for surgery, is very important, because that gives them the best chance at cure. So we tell them to put their attention more at concentrating on how well they can cope with their during their treatment, in terms of eating well, in terms of taking adequate rest, good hydration, exercises that are required, so that they will be able to keep themselves as fit as possible, and they will be able to keep themselves as strong as possible for completing their treatment. We also will encourage them, as Dr. Vinu said, we'll also encourage them and tell them that in the present era, there is a lot of advancement in surgical, radiation oncology, and in medical oncology, that is in chemotherapy and in other treatments like targeted therapy and immunotherapy. And all of these, because there is so much more advancement, we are able to have a higher chance at cancer cure and lesser toxicity that comes with treatment. So that is some of the things that we tell to encourage our patients, while they are on treatment. Thank you, Hannah, for that question.
Really, when we talk about cancer, they say it is a fearful C or the big C. And thank you so much, Dr. Saro Jacob, Dr. Vinu Sarathy, for just raising awareness on this, and for sharing very valuable insights and information on this disease. I'm sure that our viewers and our listeners will be definitely benefited from this. And also, as you said, Dr. Saro, there is hope to focus on completing the treatment. Early detection is important, and to take care of ourselves. Yes, the challenges remain, and but we can all contribute in a small way to having a better future. So thank you so much once again, Dr. Saro and Dr. Vinu, for sharing your valuable insights. Thank you. Dear viewers, if you'd like to reach out to us, please send us your message or send us an email, or you can call us at 6364 or our email ID is info@febaonline.org. Once again, thank you for joining us on our show today. And a special thank you to Dr. Saro and Dr. Vinu from Bangalore Baptist Hospital.